Meniere's disease is a disorder of the inner ear. In order to understand what Meniere's disease is, you have to have some appreciation for and understanding of the anatomy of the temporal bone. So sound comes in through the ear canal and hits the eardrum. And as the eardrum vibrates, the bones behind the eardrum also vibrate. And this little tiny bone, the stapes bone, is also set into motion. What I'm holding here is the inner ear. And the inner ear is composed of the cochlea, the part that takes the sound message and deciphers it and translates it into an electrical signal, and the semicircular canals, which basically detect motion of the head in those XYZ planes. As you can see, there are 3 of these. So what happens in Meniere's disease is that we find that there's excessive fluid, namely endolymph, within the inner ear. Now, the inner ear has 2 different kinds of fluids floating through there, endolymph and perilymph. And when endolymph becomes more voluminous, the membranes dilate, producing the symptoms of Meniere's disease. The symptoms of Meniere's disease include episodic vertigo, tinnitus, and low-frequency sensory hearing loss that fluctuates over time. You don't necessarily have to have all the components of Meniere's disease in order to make the diagnosis. There is such a thing called atypical Meniere's disease, where you can have problems related to the hearing without the problems related to the balance, and you can also have atypical vestibular Meniere's disease, where you have episodes of vertigo without any hearing loss or tinnitus. So in a nutshell, Meniere's disease is a constellation of symptoms: acute episodic vertigo, roaring tinnitus, and fluctuating low-frequency hearing loss. The treatment for Meniere's disease really depends upon the symptoms. Low-frequency fluctuating hearing loss is best treated with a programmable hearing aid. There is nothing else we have to offer for the hearing problem related to Meniere's disease. What is most incapacitating about Meniere's disease is the episodic vertigo and the change in lifestyle that the patients experience. And for that, we have many options. The most conservative option in terms of treating Meniere's disease symptoms relates to reducing your sodium intake and thereby reducing the volume of endolymph in the inner ear. So we typically ask patients to reasonably reduce their sodium intake, as well as ask patients to reduce their caffeine intake, and oftentimes this has a beneficial effect in controlling the vertigo episodes. If the dietary restrictions have not helped, then we can resort to diuretics, and diuretics are nothing more than pills that you take to relatively dehydrate the body. And what's happening here is we're trying to dehydrate the inner ear and reduce the amount of endolymph that's found in the inner ear, and thereby reduce symptoms. So initially, conservatively, we try dietary restrictions. Secondarily, we try diuretics. And thirdly, if diuretics don't seem to work as well, we try a drug called beta-histine, or SERC. There have been many European trials that have found great efficacy in controlling the vertigo episodes in Meniere's disease using SERC. We have quite a few patients that are able to function and maintain their lifestyle and go on with their everyday activities without any difficulty. For patients who have more severe vertigo, there are other options. The other options include transtympanic gentamicin, which basically involves injection of a solution into the middle ear to induce a chemical labyrinthectomy of the inner ear. So in a way, we are reducing the function of the inner ear by instilling gentamicin into the middle ear. The risk involved with gentamicin treatment is hearing loss. And that's the reason why we are very conservative with offering gentamicin treatment. Another option is endolymphatic sac surgery. And the endolymphatic sac is really a membranous extension of the inner ear. Endolymph, we think, is formed within the cochlea, circulates throughout the inner ear, filters into the endolymphatic sac, and then filters from there into the spinal fluid space and into the blood vessels around the endolymphatic sac. When the endolymphatic sac doesn't work well, we think that the endolymph backs up in the inner ear, accumulates, causing dilatation of the membranes and symptoms. So one of the treatments involves endolymphatic sac shunt. And what we're talking about here is an operation to go through the mastoid bone, the bone behind the ear, to get down to the endolymphatic sac, decompress it, and place a shunt tube. Now, this doesn't work for everyone. There's a 65% chance that this will control vertigo spells. But it is the most conservative option in that it doesn't affect the hearing mechanism. Yes. Another treatment option for Meniere's disease includes vestibular neurectomy surgery. This involves a little bit more surgery than endolymphatic sac surgery. It involves an incision behind the ear, going through the mastoid bone, getting down to and approaching the vestibular nerves. Again, these are the nerves that connect the inner ear to the brainstem, and dividing the vestibular nerve, thereby disconnecting the balance information that the inner ear detects with the brainstem. And it takes some time for patients to recover their balance after vestibular neurectomy surgery. It usually takes about 3 to 4 weeks for them to regain their balance, but there's a 95% chance of complete resolution of their vertigo spells with Meniere's disease.